Namaste, welcome to Gita's Kitchen. Today we have a very interesting topic on our channel. See, woman is considered to be Shakti, the mother of all creation. And when we talk about women's health, there are so many different issues which affect her throughout her lifetime. And starting from, say, puberty as a teenager, then pregnancy, then postpartum, that is childbirth and menopause, they affect our lifestyle in various ways. Very often what happens is, we as women, sometimes we feel shy or we feel embarrassed or sometimes we even feel afraid to take our questions to a doctor and ask them. Maybe we are afraid of the outcome and we don't know what to do. So I would like to take this opportunity to introduce to you Dr. Priti, an amazing doctor and a wonderful human being. Her knowledge is simply superb, and at the same time she is very friendly too. And she comes from a family of doctors. In fact, I have been her mother's patient. I think your grandmother too is a doctor.
My grandmother. My great-grandfather also was a doctor.
Okay, so fourth generation.
Fourth generation.
Fourth generation of doctors, okay. And I like her basic mission, that is to give quality health care at an affordable cost.
Yes.
So it's really nice that Dr. Priti consented to be on our show today.
It was my pleasure.
Thank you so much. Many of my subscribers have asked me various questions on different aspects of women's health. So this session, Dr. Priti, I think we'll just cover some of the general questions regarding women's health, because each is a topic which we can go into great depth. So this session we'll do with general questions which people have in their mind and they don't know whom to go to.
Correct.
So first let's start with the issues facing young girls, teenagers who are just starting puberty and their menstruation, and they have a number of questions. More than them, the mothers ask me a number of questions.
Right.
What is the right age when my daughter should get her periods?
There is no right age when somebody has to get their periods. It depends on how they've been, their weight has been, their food intake, and generally genetics. Say, generation wise, everyone's been having their first period at 13 years. 99% you can expect their daughter also to have it at that age. No, some patients, some young girls just attain puberty a little earlier, which we see nowadays.
Yes,
nowadays by
younger,
10, yes, even 8 years. It all depends on their food intake. Okay. See, we have to understand the kind of food we take is all adulterated.
Okay.
There is a lot of steroid in every food that we take, including our meat, our milk, everything. So we have to even take that into consideration, their weight, their physical activity. Okay. The more they are physically active, the lesser the chances of getting the periods much earlier. Okay. And their health, their fitness, their food intake, all that makes a difference.
Okay. And during periods, some of them suffer a lot due to menstrual cramps, the pain and other things associated, and they miss classes.
Yes.
It affects their lifestyle basically. Yes. So what can be done for that?
See, pain during cycles is called dysmenorrhea. Okay. This pain is very common when the uterus is contracting to let out the endometrium. The shedding of the endometrium is what we call bleed every cycle. Okay. Some people have a higher threshold, so they don't feel the pain. Some women, some young girls have a lower threshold, so really feel the pain. Don't go through the pain. This is something I advise everybody. Don't go through the pain. We are here to improve your quality of life.
So a safe painkiller like crocin and paracetamol?
No, crocin and paracetamol are not painkillers. We have to go for proper painkillers. I think widely used in the market, easily available is methotrexate. Not more than 2 to 3 in a day.
That's the advice of a doctor.
Yes, only after a doctor's advice, and a scan has to be done yearly once you get your periods. Every young girl should undergo a scan to just check if everything is okay. And a thyroid test. These are the 2 tests that every young girl, once she gets her periods, to undergo it. And something I'd like to really stress on, lot of mothers come to me saying she's got a period and then after 6 months she's not got another period. It's okay. Do not treat it till she's 16 years of age. Okay. Till her 16th birthday, give her body time to get adjusted to the hormones. She's going through a havoc of hormones inside. So let her take her time, let her body take her time to adjust to it. Give it time. Don't be in a hurry to push in hormones and say, "Are regularize kar denge." No, we can't do that. We can't regularize cycles till she is 16. Once she hits 16, normally the body takes over, has control of all the cycles. It sets into motion, and then her cycles are irregular. Then we treat. But do not hurry at 13, 14 to get regular cycles.
So normally as a mother we just suggest take a hot water bag, hot water bottle and see if you get any relief. I think if they get relief with that, then it's okay.
See, heat is definitely a muscle relaxant. It definitely does reduce, because when you go to physiotherapy sessions also, heat is something they give you. Okay. You can apply even, see, when you want the uterus to relax, it's not going to relax unless it comes from the center and the head, a stimulus to relax it. That is something we should understand. So a painkiller works that way. It works on your central system to reduce the pain. It's not that jake, it goes and acts only on the uterus. It doesn't work that way. A hot water bag is just a subjective thing which relieves the pain. It's very psychological. It could work in a lot of ways, but yes, like a hot water bag, a hot water bath, an ointment.
So if the pain does not go away with all these home remedies,
then you go.
Yes.
And when somebody says home remedies, I want to make them understand no concoctions should be given. Eventually you're going to get only acidity. Nothing else is going to come out of it.
Yeah.
Yes.
Okay. Then there is often this question about discharge.
Right.
Vaginal discharge and whether any foul smell, whether discharge is normal at all in the first place.
Before periods and after periods, everyone gets a clear discharge, and in the middle of the cycle also. That shows that your hormones are in place.
Okay.
One of the ways of telling. If you don't have a discharge, there's nothing to worry. But if you do have a discharge, if it's clear in color, no itching, not foul smelling, it's absolutely fine. You do not require to treat it. As long as you maintain your body hygiene, it's absolutely fine. But if the discharge is curdy white or cheesy in consistency, you really need to meet your gynecologist immediately. Yeah.
Doctor, you just mentioned as long as you maintain your hygiene. So this is another very important question. People ask, what are the basics of female hygiene? This is not often talked about openly also. Sometimes even mothers hesitate a bit to talk to their children about it. So here as a doctor, what would you tell about female hygiene?
If you're wearing underwears regularly, then I don't think you need to keep your pubic hair. Please make sure you shave your pubic hair or wax, or you can use any kind of hair removing creams, whichever you're safe, whichever you're comfortable with having no allergic reactions to. Every week, make sure hair is removed if you're shaving it, and do it in the direction of the hair growth, not in the opposite direction, because that can cause some rashes. And every time you wash yourself, twice a day, washing with a cleanser is important. It can be a soap, it can be an intimate wash, but make sure you wash your private parts twice a day with soap and wipe it dry. Every time we go to the bathroom, we wash ourselves, we have to make sure our external genitals are wiped dry, and then only wear a garment like your panties, and as much as possible wear only cotton panties. If we all are young, we all like to look beautiful even under our clothes. So if you're wearing lacy underwears or anything, make sure you change them every 4 to 6 hours, because they don't really absorb your body.
Especially this humid climate, lot of sweating also can cause.
And something I tell young girls and adults also, that other than removing your hair, try to avoid wearing underwears in the night, a panty, so that airing is very important. Every part of your skin, your body has to air well. If you're wearing pajamas or something, try to avoid wearing underwears in the night, except when you have periods. And when we talk about discharge also, when it's a clear discharge, it might come out, stay in your panty, and over time can look white in color. That is nothing to worry about if you do not have itching.
What about wearing bra at night?
No, I don't suggest, and it's
That
not
also
good.
is better to loosen it or remove it?
Loosen it, remove it. Yes.
Okay.
If you're comfortable unhooking it and sleeping, nothing like it. If you don't have to wear it at all, even better.
Okay.
When you are lying down, do not assume that it will sag. It does not sag when you're lying down.
Okay.
Yeah. But daytime, yes, please wear a bra which fits well.
Good support.
Yes. which it make sure that it's not too tight, because that itself can cause breathlessness.
Okay. See, because I had consulted somebody for back pain a couple of years ago, and then my orthopedic, that physiotherapist told me specifically about this.
A good bra.
She said, please remove your bra at night, and it is very important, so that you don't get all your shoulder pain. And
basically, what happens is when something is on, even a strap, can cause your muscles to contract 24/7, which can give you pain over time. Yeah.
So these are all simple everyday things,
Yes.
which many don't know, or often we don't have the correct knowledge about it.
And most important, your lingerie, your panties and bras have to be washed after every use. I have seen, when I was in a hostel, I had seen, because of laziness, all of us used to wear it. Sometimes, your braceries, we used to wear it once or twice continuously. That I would say completely avoid.
How about using tampons during the periods? Is it safe to use
Oh, yeah.
for unmarried girls also? Is it okay?
See, married or unmarried, tampons are something which are going to be inserted inside your vagina. Some young girls are comfortable doing it, some are not. So, for any age group, tampons are absolutely safe. Only thing is, you have to make sure you follow instructions that every 6 hours, whether it's wet or not, it has to be changed. Yeah. Do not try to avoid wearing a tampon when you are asleep. Yeah, because we normally stretch it for more than 6 to 8 hours. So that can cause some staphylococcal infections, which can be
always safer to go for pads, I think, right?
Yeah.
And how often do you need to change pads?
Pads or menstrual cups.
I think menstrual cups is something we should
talk about.
Yes.
Yeah. Menstrual cups and pads. Menstrual cups, it depends on whenever you can. You'll know. It gives an indication. You know when to empty it, when to wash it. Make sure it's hygienically washed and inserted back. And a pad depends on what kind of pad you're looking for. It can be extra dry, it can be a regular pad. Normally, pads also should be changed every 6 hours, whether it is wet or not. Yeah.
So that is basic about regular
Basic, yes. And make sure your underwears are changed, your panties are changed every 6 hours when you have your periods. These are regular hygiene tips that everybody
washing
should follow.
also, I think the front to back washing.
When you wash your genitals in your private parts, we have to always wash your pubic area, vagina first, and then go to your buttocks. Do not wash your buttocks first and then come to your vagina, because the bacteria that's in the buttocks is going to cause a lot of infections in your vagina. But the vaginal bacteria will not cause any infections in your buttocks.
Then talking about menstruation and periods, PMS. Okay, it is more a problem for the parents than the girls who are undergoing.
No, I think it's a problem.
PMS even stretches on to, I think, to your later years also, 40s.
Yes.
Yes.
See, PMS are again mild, moderate and severe. When it's mild, like something you can handle very well, like a back pain or a breast pain, very physical conditions, we just give them some medication to cope with it. And when you exercise regularly, your PMS symptoms are much lower.
For those who don't understand PMS,
it's called premenstrual syndrome. This is from 15 days before you get your periods. Normally 10 days, but it stretches to 15 days before your periods because of the sudden hormone changes in your cycles. There is a drop in estrogen, increase in progesterone, which causes a lot of havoc.
Heaviness in breast.
Exactly, and a lot of water, fluid retention in your body. Sometimes hair fall.
Right?
Yes, and a lot of nausea, irritability, easy to cry.
Mood swings. I found you get anger at snap at everybody.
Yeah, but this is very, like I said, it is something we have to put in a lot of effort from inside to control it. We know it's coming, so some amount of diet restrictions. Taking some phytoestrogen foods, which we should talk about in one of our
What exactly is phytoestrogen?
Phytoestrogen is something which converts into estrogen once you eat, so that it will calm you down a little bit. It will take care of your mood swings.
In which place is it from?
Most commonly, it's always there in our kitchens. Besan, channa, tur dal, All these things. We will do a
This
topic
is
on
part of our everyday, whether South Indian or North Indian. We have it as poor dal.
Exactly. It's there in our kitchen. Our channa is one of the most strongly strong phytoestrogen that we see. We will talk about it in
separate on diet.
Yes. How it even helps menopause in women. It will really help. And exercise. Your workouts are so important. When you have a continuous schedule of workout, the hormones that release when you work out will really help in reducing your PMS symptoms. Something I want to really mention, there are a lot of people who say pop this pill, pop that pill, your PMS will take care. No, PMS does not work that way. You cannot control something like PMS with just a pill. Exercise, a little bit of meditation, and knowing that you're undergoing PMS. And also, I think your surrounding people who are with you also have to be a little understanding, because the body takes a little time to understand PMS. So I think all that really would make a lot of difference.
All about your emotional PMS.
Exactly. So that's about your partner or whoever is in your house, whoever you are with, hoping that they also understand. And I hope that this video can educate them to understand that PMS is a condition and we need to just learn to work around it.
Yes. These hormones can play havoc with our
so when something like that is happening, I would like to tell everybody around the lady who's undergoing PMS to be a little more understanding and understand the situation and give it some time.
Okay. So it's the hormones which are responsible for it.
Not the person.
Not the person. That is true. Another common thing we hear of today, doctor, is this PCOS.
Yes.
Every other person I speak to, they talk, which was not so common in my younger days. What is it and what is the reason?
PCOS is polycystic ovarian syndrome or a disease, whatever you can call it. See, this is a lifestyle condition. Like, probably we see an increase in it. One, because our lifestyles have changed. We are not physically that active at work, what we wear, which is a given. It is established. We don't run around as much as we used to, as in we are not on our feet all the time. Sudden weight gain, again zero workout, sedentary lifestyle. Unhealthy food. Yes. Yeah. And see, it's okay to eat unhealthy food, your junk food. Binging that is something we have. Yes. If you do it every day also, there's no problem, as long as you are working out that much, keeping your cholesterol under check, it's okay. But we don't see that happening. There's no balance between your food intake and your workout, which can cause polycystic ovaries, again, which is again hormonal because of your fat cells increasing in your body. When the fat cells increase, they produce hormones which cause havoc, and because of the hormonal imbalance, you tend to gain more weight. So it's like a vicious cycle which is worsening the polycystic.
Which again in end it affects your pregnancy also.
Absolutely. It's one of the leading causes of infertility right now in India. 8 out of 10 young girls are seen to have polycystic.
So I think mothers should take care right from their younger age. The children get good diet and at least they go for a walk or play some
activity.
Game.
I feel exercise should be a part of your lifestyle. Like how you brush your teeth, you have a bath every day, workouts should be a part. And please understand, sports is not exercise. Sports is building team spirit, exercise is exercise. That is something I noticed.
As you rightly said, just as we brush our teeth, you can't miss your walk or your exercise.
Yes, part of
every day.
Absolutely.
Okay. That's really nice. We have spoken about teenagers, PMS, and then slowly as we grow in age, we reach that menopause. Okay, say 50 plus would be a right?
45 plus, I would
45 plus. Okay, and there's one question which I would like to know, because along with this, we also get different problems with our bones.
Correct.
And what is the relationship? And people who have undergone an early hysterectomy, that is removal of their uterus in their earlier years, does that affect their bone condition in the later years in any way?
See, so menopause naturally getting is one thing, and surgical menopause is another thing.
Yes.
What we have to understand is, if the ovaries are left back, you're still going to produce your hormones. Only difference is, your uterus is removed, you will not get a period.
Correct.
But your ovaries, if they are left back, which normally we retain back for young women, unless they have a problem with the ovaries, you still don't hit menopause. As in, you don't get your, just because your periods have stopped, doesn't mean you've attained menopause. We have to understand that the ovaries will keep releasing their hormones. When the ovaries stop releasing the hormones is when we attain actual menopause.
Okay. So stopping of periods alone is not menopause.
No. If your uterus is alone removed, your periods are not going to come. But your ovaries are there. So which means that you're not menopaused. You're still having your hormones, you're still having your calcium depositions in the bones, everything. When you attain menopause naturally, that is when your calcium in the bones is going down. That is why we say once you hit menopause, start off on calcium. Because what it's going to do is, it's going to make your bones a little weak. I'm explaining again in layman terms. Yes. I'm not getting into the medical part of it. Basically, your bones are going to become weak, causing osteoporosis. Okay. So what happens if I have osteoporosis? What's the big deal? Why do I have to worry? Because in case you fracture, you hit yourself somewhere, your bones are going to break easier. They're going to take a lot more time to heal than a normal person. Okay. So that's why we say once you get into menopause, we start you on calcium. But again, calcium cannot be popped by any lady. You have to make sure your BP is under control. You have to make sure that your BP medications do not interact with the calcium you're taking.
Okay, so that we just take a calcium
exactly.
tablet.
Yes.
That's a very important point.
Very important.
In fact, I used to think that I just start taking calcium like I would take a B complex or something.
You can't do that.
Okay.
Even your multivitamins, your sugar levels have to be checked before you take it. See, back in the day, no one thought of all this. We didn't have this much evolution also in medicine. So people would just pop a pill whenever they wanted a calcium. And ye nahi ki calcium works ki today one day I take calcium, my pains are fine, I don't take. That's not how it works. We need to take calcium continuously. We need to take multivitamins continuously. And the timing of taking calcium, the timing of taking multivitamin in your routine makes a lot of difference. Okay. You can't just take a calcium in the morning and expect it to work. Sometimes you need to take it only in the night for the absorption into the bones. Sometimes you just need it in the daytime. So that is important only after you get your blood pressure checked. So even if you want to start calcium or multivitamins, make sure you visit your doctor once. Visit us, we will check your BP, we will check your blood pressure, we will check your sugars and then start you on a type of calcium and the dosage of calcium. Because Indian food, we have a lot of calcium. So we really don't require a high dose of calcium.
Okay.
But definitely post-menopause, we need substitution for calcium. We need replacement.
Thank you for educating me on that. And thyroid again is another common issue today. Thyroid problem, I think hypothyroidism is
hypothyroid, yes. More commonly
more
seen.
common, yes.
Not like hyper is not seen, but more commonly is hypothyroid, which a lot of women think that when I get the symptoms, if I have it. No, sometimes it can be asymptomatic.
Exactly.
Every year I tell ladies, all my patients, please get a thyroid check done. You don't require a doctor's slip. You can go to any diagnostic center or a hospital with a diagnostic center and get a thyroid test done.
I was not aware of my problem till I have gone in for some other surgical procedure and they asked to get a number of routine tests. And that time I found that I had this problem.
Which can cause so much havoc in your life when you don't know that you have had it and then later when it's too difficult to control it.
Correct.
So get a thyroid test done for all ladies and everybody.
From which age onwards?
Once you hit your periods.
Oh, right from the
Yes. Once they get their first period. And because at birth, every hospital pediatrician does a thyroid test for the kid. Okay. And then if thyroid occurs very early in life, we see a lot of symptoms like thyroid symptoms. We'll talk in depth about it.
Okay.
And otherwise, once you get your first period, I suggest everybody to get a thyroid test and a scan of the abdomen every year, yearly once.
There was one more question from one of my viewers. She was asking me about diabetes in the first trimester of pregnancy and what she can eat and what she can't and what she should do about it.
Right.
So you are the best person to answer.
First and foremost, make sure your sugars, if it's a planned pregnancy, make sure your sugars are under control.
Okay.
Before you plan a pregnancy, we have to make sure that your sugars are under control if you've already been a diabetic person. And start off folic acid. And say you've gotten pregnant, it was unplanned or planned. You didn't realize you had diabetes also. And then you go for your first check. As soon as you're pregnant, there is a list of blood tests we ask for, which has to be done. Why do we do it very early, including sugars and all that? Is so that in case there is some issue with the blood reports, we can control it and not lose the pregnancy. So when your doctor says your first visit, do a certain test, is very important. Just do it. If you have diabetes and it's controlled, there's nothing to worry. You can take a controlled diabetic diet with a low calorie intake, low sugar intake. We have special charts for that depending on your weight. And in case, say, it's uncontrolled, there is a good chance that you can have abnormalities in the fetus, so which we explain to the patient well ahead of time, because it can cause heart diseases in the fetus. It can cause some limb abnormalities also. So we tell them much ahead in time so that they can plan whether they want to terminate or continue the pregnancy. Because some can be life-threatening for the fetus, some may not be.
Okay.
So we have to have a close follow-up. When it comes to exercise, it's very important in diabetes. A walk every day if you're pregnant is very, very important. Not a brisk walk, but a walk. Just to lower your sugar levels a lot and decrease your insulin production, so that the food sugars don't get absorbed into your blood.
But there's nothing to be too worried. I think she can still...
Oh yes, she can continue as long as they're all under control. Mostly once we see diabetes in pregnancy, which is called gestational diabetes, which occurs only in pregnancy, then we put them on insulin. 99% of us, we put them on insulin to control your sugar levels. And also, most important is a close follow-up and a close association with your doctor on your sugar levels. Don't think that we take one, we stop it, we'll take it when the sugars rise. No. You have to be a little more alarmed about it, a little more cautious about it. Check your levels, because your doctor may not be by your side 24/7. You have to take active interest in checking your levels.
Close monitoring.
Yes, very important.
So now we have touched a wide range of topics
Yes.
on women's health, starting right from teenagers up to menopause. And I'm sure all the points which are going to be of immense help to our viewers. They would like to know whether they'll be able to contact you, or do you have any video consultation which you can do for them?
I am there in a couple of hospitals that I consult at, and if you just, I will leave you a link with my video consultations. You can just always, I'm available, prior appointment basis video consultations. If you can go to my Insta page or my website, everything is there.
I'll give you those links in the description box, because they have a wide spectrum of
Doubts? Yes.
No, your services,
Yes.
the wide spectrum of female reproductive health, the
Yes,
kind of
yes.
services you do. So I'll definitely give the links in the description box, and you can have a look over there. So thank you once again, Dr. Priti. Very kind of you to
It's my
give us
pleasure.
some time and come on our show, so that so many people all over the world can
Yes.
be helped with this basic knowledge about women's health, which we
Right.
generally ignore. Generally what happens, the woman doesn't focus on her health, and she keeps looking at the health of other members of her
Yeah,
family.
but like we always say, if a woman is educated, the family is educated. If a woman is healthy, the family is healthy.
Perfect. So the woman's health is most important for her family's health too.
Yes.
Thank you so much.
Thank you.
Thank you for watching the video, and I am sure we can look forward to many more such episodes on women's health, provided Dr. Priti is able to take out the time for it.
Anytime.
Please subscribe to Gita's Kitchen, and we'll meet again with another interesting video from Gita's Kitchen. Thank you.